Great. So thanks everyone for joining. Really excited to have this workshop or this webinar today. We have Trinity Zahn and Christine Lasway from FHI360 presenting today on their experience pursuing several pathways to sustainability for the FHI project, which they'll tell you about more. And I think they're really going to focus on the process that they used to identify and test the different pathways that they were exploring. So I think there'll be lots of interesting lessons for all of us. And there'll be a discussion session at the end of the presentation, and we'll just kind of open it up then. I think maybe the easiest way to have that without everyone kind of talking over each other will be for everyone to be on mute, but then you should be able to unmute yourself and ask any questions or respond to anything. So when we get to that section, I can help moderate if it gets a little too crazy. But I know that Christine and Trinity have some questions that they've prepared to get things started. But maybe I'll pass it over to, I think, Christine, who's going to start. And you should all see her presentation. If you're calling in on the phone, apologies. I think maybe just the easiest thing will be to send it out after at this point.
Okay, thank you, Francis. Hello, everyone. Again, my name is Christine, and I'm here with my colleague, Trinity. We are part of the M4H team. We're actually a bigger group than this, but today we'll be basically presenting to you some of the path that we took and some of the lessons that we've learned, and also hoping to discuss with you and learn from you in terms of how we move these projects into sustainability mode. So I'll first kind of give you a little bit of introduction about M4H, what that is, and sort of the evolution of it. And then we will tell you how we define sustainability and the steps we took in terms of pursuing sustainability. And then Trinity will take over and give you some more information in terms of our country-specific experiences. And then we'll finish up with some lessons learned and discussions. So M4H actually stands for Mobile for Reproductive Health. It was a project that started in 2009, funded by USAID. It is a text-based messaging program, basically a communication program, specifically on family planning. It's an on-demand service, meaning that people can come in at their own time, any time of the day, to access the service. And it's also driven by a menu. So you go in and you essentially text M4H to a particular code number across it's available across different networks, and you can choose what kind of information you want to access. So we launched the service in Kenya and Tanzania in 2009. And so far to date, we have over 2 million hits and over 300,000 users in between the two countries. So as I said, we started really in 2009, and we started as a research study because this was very new to us. We were trying, and at that time also it was new in terms of the mHealth sphere, and we're trying to really create something that's evidence-based, trying to also learn how it's working in the field in terms of uptake, acceptability, usability, etc. So we, in the first years, we really focused on trying to use behavior change approaches and principles to really make sure that we are following a sound process in our content development. So we spent a lot of time doing that. And then we pilot tested in a very small scale in Kenya and Tanzania, primarily in facilities and in community health programs. Then after we got positive results with the service in both countries. In fact, I think we started scaling up even before we started doing the pilot testing, because there was a lot of interest locally from different partners, including the ministries of health. In 2012, in particular in Tanzania, we were able to get into a partnership with Johns Hopkins University, which allowed us to be able to scale up the service nationally. So that was a great addition, because we didn't really have the capacity to go national, and they were able to go national for us. Basically, what that meant was that M4H was put on a mass media campaign that they had, so it was able to reach everybody nationwide. We also expanded the content that we had, because we had basic content. Remember, as I mentioned, we designed it for a pilot test. So now we were able to really expand on the content with great support from the mission there. And therefore, we launched what we called M4RH Plus, and really focusing on supporting people, not only in terms of adopting new methods, but also continuing the use of the method. In 2013, we started getting interest from other countries as well for the service. In particular, Rwanda, we had the opportunity to be able to work there and adapt our content, but specifically for youth. There was the target group there. And so M4H then was expanded in terms of content to include not only contraceptive methods, but also sexual and reproductive health in general, which was, it was great to have that opportunity. We continued work in Tanzania, and in 2014, again, because of the strong mission support there and interest, as well as the government interest, we also received funding to expand the content to include youth. Because we had already the content in Rwanda, it was an easy transition and adaptation process for us. So in 2015, we just recently actually launched the youth component of it. So in Tanzania in particular, we have the expanded content, but also just the youth-specific content, as well as now we also have an opportunity working in Uganda as well to adapt the content there. Now, this presentation is about sustainability, but I thought I would give you a little bit of the background of that. We really, even though we were talking about sustainability from the beginning, and really it was part of the design process, we really didn't have resources to be able to focus on that. And really, in the beginning, we were trying to learn about the program and really try to get buy-in also from the partners and see what the interest is. So we were fortunate to be one of the grantees for the UN Catalytic Grant. And so we started really actually having funding and working on sustainability in the beginning of 2014. I should also mention that FHI is not the only organization that's been working on M4H. There's been other interest from other organizations and in other countries. So at the bottom there's M4H has been adapted in Nicaragua by Chat Salud, Mozambique by Pathfinder, and also now we have a lot of work. We're partnering with WHO on an armadillo project in Kenya. So when what we proposed in our UN Catalytic Grant proposal was three. We were going to investigate three pathways, as we called it. We were looking at partnerships with private companies and organizations, including mobile network operators. We're looking at user fees as one of the ways that we could generate funding for M4H, as well as marketing the service at different price levels to different sort of market segments. When we started working, our sort of thought process evolved, and the first, we kind of went through three different steps that I'll explain. And the first thing was really we needed to sit around the table and figure out what is sustainability. As you all know, and I'm sure we'll discuss that later, everybody has their own definition of sustainability. So for us, what we concluded were two things in particular, and we do know that sustainability means much more than this. But for this project, we focused on financial viability and social impact to mean M4H sustainability. Now, what do we mean by financial viability? And for us, that meant finances, meant that M4RH at some point will be financially self-sustaining and considerably and progressively less dependent on donor funding. And then also, it meant that we're not just generating funding to recover costs, but also generate a profit, meaning that profit is going to be turned back to the service so that we can grow it, we can expand it, and enhance it. So that meant two things: being able to figure out a way of generating revenues as well as reducing costs. Now, we had several brainstorming sessions where we came up with different options for doing so, increasing revenues and reducing costs. We had several consultations at the country level, and we came up with, with the usual sort of user pricing models for revenues, push advertisements for also increasing revenues, and then trying to figure out where our efficiencies are in our processes so we can reduce costs and things like that. But then the question came, of course, of what could work, what's feasible, and I'll discuss that in a second. So that was financial viability for us. Then we went into social impact. And this, of course, again, everybody defines it in their own way, and we know that it's a struggle in terms of kind of figuring out the metrics and how best to measure it. But for us, we wanted to retain social impact. We knew that, for example, if we introduce user fees, there will be a reduction in reach, but we didn't want that to really be a significant reduction. So we said, three things. We still want to be able to increase reach, because we think that if we're able to leverage the power, of maybe like a social business model, we should be able to increase more reach. Then we said, let's make sure that we are keeping our demographic profile. It was very important for us to be able to reach young people in both rural and urban areas, and also people of different wealth quantiles and education actually levels. And then also we wanted to reasonably maintain traffic levels. We knew that's gonna go down, but we wanted to still say, okay, it shouldn't considerably go down. We didn't get to what's that reduction, what are we comfortable with in terms of going down, but we said, let's maintain our traffic level. So the next step then, after coming up with those different options and definitions, was, okay, what's the viable option? What's a viable option for these two different countries? In particular, we're focusing on Kenya and Tanzania. The process that we took, we used decision trees for each of the options that I shared earlier, for revenue and cost. And then and I'll show you an example of a decision tree in a moment. And we basically did we conducted a lot of consultations with different stakeholders. And then in the private sector, the government, the donors, different partners, we sought to understand our operational costs, like what does it take to really maintain, what are the recurring costs that we are going to incur for this. We did several break-even analysis and other aspects of economic analysis and modeling to really inform our decision process. So this is an example of a decision tree, and I apologize because the font is a little bit small here and you may not be able to see it, but it's one on the user fee option that we were considering as a way of generating revenue. So we asked ourselves, we had different decision nodes that we had to go through, and in each decision node we had to find information to be able to inform that process. So the first question for us was, would users be willing to pay? So for example, we did a survey, and it was an SMS-based survey on willingness to pay in Tanzania, and we found out that almost half of our users were willing to pay some amount of money for M4RH. And so when we found that, we were convinced by that data, and we said, okay, yes, they will be willing. At least we are comfortable with that 48% number. Let's move to the next level. And so Trinity will talk a little bit about what we did in the next steps to arrive to the decision. So we went through several decision trees and then came up with some decisions on what to pursue for each country. I just wanted to, I'm not going to talk a lot about the break-even analysis, but here I just wanted to share with you, we looked at our operational costs, we looked at some possible revenue generating options based on user fees. We created certain assumptions, and we had 4 scenarios. And we found actually 2 scenarios that we simulated were able to break even. We're able to break even and actually make a profit. And then 2 scenarios we were not. And in those 2 scenarios that we are able to break even, it is essentially users needed to pay for the messages back and forth. Typically in the countries we operate, users are only paying for messages that they send. So we needed to have both ways. But one of the very important lessons that we learned from the break even is that we could not just depend on user fees. We needed to have multiple strategies for revenue generation and also cost reduction for us to be able to really generate a profit. So we came up, this was the last step, we came up with decisions at some point. And I have to say that even though we didn't have all the answers at this point of the decision-making process, but we needed to make a decision because we needed to move on. So in Kenya, we decided to do a user fee experiment, and in that be able to answer more questions. And in Tanzania, we felt that we needed to engage in a partnership with another partner who actually had the requisite capacity, skills, and expertise, knows the local contents and the local players there, who can come and help us really design a robust model for like a business model, because we didn't feel that we had that capacity to engage at that level. And so that's what Trinity is going to talk about next. Just bear with us as we shift a little bit.
All right. Hi, everybody. Happy to be with you today. So we're going to walk through each of these, and I think Christine did a great job of giving us some background, and I'll try to hopefully make this a coherent thread, but bear with us and we can go into it more in the discussion if we need to. So in Kenya, oh gosh, this says the meeting's going to end in 10 minutes. Okay. In Kenya, as Christine mentioned, we decided after we went through the decision tree about user fees that we thought we had willingness to pay. We could not answer the second question, which is what would the impact be if we did implement a user fee approach. And so we thought we would test that. So as you see, the goal was really to test the effect of charging users on reach. And by reach, we meant both the overall traffic, overall system use, but also looking at the demographics to understand who we would be reaching and how much that would change from a scenario when it was free. And so being that FHI is a research institution as well, we wanted to approach this from a research perspective and make it as rigorous as possible given the constraints. And so the design that we settled on was to essentially compare via 2 rounds of limited promotion, the use of M4RH. The first round would be when it was being promoted as a free service and accessed as a free service. And the second round would be when users would be asked to pay. And so we did a fairly limited radio promotion, about a month's worth of promotion on one English language radio station in Kenya. And we could get into this more, but we did a lot of debate about what station to choose, whether to promote it in English or Swahili. The content is available in English in Kenya. And of course we had limited budget, and so we ultimately settled on one of the more top tier radio stations, but that has good access in largely Nairobi area. And we were hoping to reach about 3,000 users, have 3,000 people access M4RH in each round, so that we could get about a third of those responding to our survey questions, because that's usually the rates that we see. And what we planned on doing was collecting demographic data about age, sex, the county, sorry, that should be county where they lived, their educational level. And then in round one, we actually wanted to ask about their willingness to pay and then use that to set our price point in round two. So that was the goal. Sorry, what do I do here?
This should be page down.
Page down, sorry.
Huh.
Are we not here? Hello?
Yep, we can hear you guys.
Oh, for some reason it's not advancing, sorry.
I don't know why. Okay.
Okay. So this is what we did. We did go forward with round one, and that was the free round. And what we saw was a total enrollment of about 900 people. That was far short of the 3,000 that we were hoping to get. And the amount of people who responded at least to the first question was about 500. So we had some concerns about what our enrollment would look like in that second round when we would actually be asking users to pay for the messages that they were, in this case, sending, as well as those demographic questions that we would send to them. They would have to actually pay to respond. So we're a bit concerned about what our overall sample size would be in that round two. And therefore, from a research perspective, unfortunately, we had concerns about our ability to compare those two samples and make conclusions based on that data. So sadly, we have to report that we decided not to pursue the round two and rather to use our resources elsewhere within the project. What I can say though is that we do have some data that we were able to glean, which we feel like is interesting. And I also think that it's a really interesting case for challenges and for how to approach this type of an experiment that we'll talk about at the end. So we did do the willingness to pay. In this scenario, we gave people the option to say that they wouldn't pay for, they didn't want to pay anything, which we did also in Tanzania. And here, 67% said they were not willing to pay. So that was interesting. Of course, there's a big debate in communities and within among economists about how kind of faithful willingness to pay data is and how useful it is. You can see some other stats, fairly high educated population, predominantly female in this case, really wide ranging in terms of ages, but 76% were under 25 years. So definitely confirming the young demographic, which of course could be linked to how this was promoted. So the challenges for us in attempting this experiment were that we did have fairly limited promotion, and we saw that in the results of uptake. We have struggled in Kenya in the past and have talked to a lot of different people about similar challenges kind of getting traction with an mHealth service. And so we've had a lot of debates around sort of the saturation level and what kinds of interest there may be in these types of services. And we wondered if that may have come into play. And then this last bullet is really the one that I wanted to talk more about at the end if we have time. But because we approached it from a research perspective, that drove our decision-making and the concerns about sample size and ability to draw conclusions. But we had a very robust internal debate about whether we should proceed nonetheless, because any data could potentially be useful. And so this kind of tension between research and practical application, practical experiences, and how you derive conclusions from those. Page down.
Okay.
Sorry. So then in Tanzania, as Christine mentioned, we kind of took an even more macro approach. So we had done some of these different decision trees, but ultimately we kind of bumped it up a notch and said, what we really want to do is look for a partnership that's going to allow us to potentially further explore some of these pathways, because they will have some of the expertise that we don't have. So we issued a call for expression of interest in March, and we put that out via our website and via networks, and just asked if there were businesses or organizations, they could be nonprofits, they could be for-profit, who were interested in partnering with us to increase the reach, increase the sustainability, and maintain a social impact for M4RH in Tanzania. 19 organizations responded, which we were pretty excited about. We then developed a much longer partnership solicitation document, which in some ways resembles, an RFA, where it provided a lot of background information. We provided the operational costs for M4RH information, data that we've collected in the past about demographics, and then kind of outline what we hope to happen through this partnership and sort of what we're looking for in potential partners. So we sent that to all 19 organizations in May, and we asked for a fairly short turnaround, I think about a month. And so we got 3 full responses in June. So 3 out of the 19. We have reviewed those. We are having consultations with the applicants as well as the various stakeholders within Tanzania who need to weigh in. And we're hoping to make a decision by the end of August about who among those 3 we will pursue partnerships with. What's interesting, I think, in the Tanzania example, and of course we're still in it, is the 3 full responses that we received actually are quite different. The organizations are quite different, and their interests and their kind of proposed approaches are quite different, which is not so surprising to us, because I think we, as we mentioned earlier, with all of the options that we came up with, knew there are many options to explore. But it was interesting to see, kind of from a very technical new business entrepreneurship type organization all the way to a for-profit, and then to a kind of more traditional nonprofit, a range of folks expressing interest. What we are seeing, though, to be very honest, is that avoiding donor funding entirely is really, really difficult for multiple reasons. And so that's something that we will continue to struggle with. And although we very clearly, in our original definition of financial viability, wanted to take a perspective of not even simply recovering costs, but potentially generating a profit that we can reinvest, how we do that still is an open question, and the role of donor funding within that equation remains to be seen. And we also realize that there is quite a bit of ambiguity around what we mean by social impact, and similar to sustainability or even to scale up, 1,000 definitions for 1,000 different people. When we asked the applicant organizations to tell us how they would measure social impact, not a one actually had an answer, but rather said, yeah, we'll talk about that together. Fair enough. But so I think that in and of itself is a challenge to arrive at a common understanding and definition, and then identify how to measure. So those were our 2 country-specific organizations. We wanted to throw in quickly a mention of kind of a third parallel prong, I'll call it, which is more linked to scaling M4RH perhaps than to achieving financial viability. But it's definitely coming into play with how we're continuing to expand M4RH. And so we wanted to quickly mention it. Essentially, we receive a lot of requests for M4RH content. And as Christine mentioned in our evolution slide, several other organizations have already taken it and adapted. And so we have an interest in maintaining the quality of that content. We have a certain level of accountability in some countries like Tanzania, where we've been operating for a while, and people look to us to ensure the quality of that content. And to a certain extent, there are kind of links to branding. So we decided that we would develop a license for the use of the M4RH content and the brand and the mark. So far, we've provided 5 licenses, and we have several more in the pipeline. And so it's been an interesting, I guess, journey to what that means. I think probably all of you know about some of the global dialogues going around about, kind of maintaining, maximizing open access to information, but then there are certainly concerns around quality control. And so that's been a big challenge for us internally, is to understand how we can do both of those at the same time. And it's still evolving. We have currently our own type of license. We're looking at Creative Commons and what type of a Creative Commons license we might want to shift to. So that's happening in parallel to all of these other discussions and activities. So in sum, we've definitely learned a lot. Not that that means that we have answers to a lot of things. I think we have many questions remaining, and I'm sure that many of you all would both share in these lessons learned and then in the questions that we'll pose next. And so, again, sustainability can mean many things. So our task, as folks who are interested in achieving sustainability, is to really clearly understand for ourselves what that means for us and for our services, and then be able to articulate how we'll measure and monitor that. And that's tricky, not easy. Certainly, as we all know, sustainability really starts from the beginning. It's less helpful if you start thinking about it from the middle or at the end. And so I think that with M4RH, there were definitely certain aspects of sustainability that we were considering from the very beginning, and others that we may have considered but weren't able to tackle, like the question of kind of avoiding donor funding. Early on, it was donor funding, and we decided to make it free so that we could really understand with no barriers to use how people are using it. But now we have to tackle these questions at the middle and the end. It really, you must be able to navigate across these multiple sectors. At least for us in a public health kind of domain, we have to operate with government, with private sector, with civil society. So we need to be able to engage, understand who those people are, how to talk to them, and have relationships with them. And if one of those pillars is not really present, I think it makes our overall case, our overall stool less sturdy. The private sector engagement definitely requires a solid analytical business case. And for the most part, our team has been more public health minded. But we have been growing and learning, and we've been able to pull on some resources, and Christine is one of those who have more expertise in the business area. But that's absolutely what's needed to make that case to the private sector. And so I think we all know that. It's just a matter of how you can find that capacity and expertise and then develop that case. And then finally for us, that there is not a single solution for achieving sustainability. I think we knew that even early on in the proposal, we wrote that it was likely we would explore a combination of these, and we're finding that to be definitely the case. And Christine alluded to, even in our modeling, user fees alone wasn't going to get us there. And so it's very clear that we need to pursue those strategic partnerships. We need to look at how we might be able to charge users. So in the two equation of reducing costs and increasing revenue, there are multiple things that we can do. And most likely we're going to end up putting those together to really get somewhere. So this is where we wanted to leave it. I'll leave this slide up, and I'll just quickly walk through these questions in case any of them aren't very clear. But then we thought it would be great to just open it up. And of course, we'll take any questions, but since we're all doing kind of similar work here, I'm sure these are going to ring true. So one was, how do you all define financial sustainability, and how did you arrive at that definition? We told you a little bit about how we got there, but it'd be really interesting to hear from others. What were your decision-making processes around exploring different potential pathways? We kind of use this approach of a structured decision tree and consultations and some kind of using data to do some modeling. But again, it'd be interesting to hear from other people. The concept of the user fee approach, I know people are dabbling in it. One of the reasons that we decided to do the experiment and try it with a research perspective was to actually have some good data that we could put out to the world, because we hadn't seen a whole lot of that. But I know we'd be interested to hear from others if they have successfully measured a user fee approach and how it impacts reach. And then finally, if anybody has nice definitions for social impact and how you may have measured or are measuring social impact in your own work. So those are our questions, and yeah, we're excited to have a discussion. So thanks.
Thanks, Trinity, and thanks, Christine. It was a really great presentation. And I think these are really nice discussion questions that we can kind of, we can start with. So do we want to go ahead and tackle the first one? And I would just ask, people can unmute themselves to respond. And I think I didn't do a roll call earlier, so if you want to just state your name and the organization you're from, maybe the first time you speak, just so people know who everyone is, that would be great.
And we're happy to take questions on whatever we have presented as well.
Great.
Hi, Trinity and Christine. This is Garrett. Mel, it was a great presentation. Thank you so much. My question is really focused on, I realize you presented a decision tree for user fees, but I'm curious if you could provide a little bit more context for what led you to focus on that as, excuse me, hold on, sorry.
Focus on user fee.
Sorry, user fees as a way of generating financial sustainability, and whether, like, what premise was it that you wanted to sort of address in the financial constraints that you were that in terms of running the project led you to think that user fees would be the approach that you would take, and yeah, it would be curious, and I wondered only because I'm thinking that the kinds of partnerships that might have come up, say, with an insurer or a group that where the kinds of content that you're delivering mitigates or reduces perhaps the costs of subsequent treatments might have been an avenue for an insurance company or a government to want to make investments into and partner with you and offset some of your costs. So sorry, the question is why user fees? And had you thought through other kinds of mechanisms to offset your costs? Thanks.
Yeah, okay. I can start. So first of all, let me just explain user fees, because that can mean many things. And because, there's different markets for where you can charge user fees. In particular, for the decision tree that we were talking about, we were referring to the customer, to basically the end user, whoever is using FHI on a continuous basis. And why we decided that? First of all, when we look at our cost structure for FHI SMS is the biggest component. Essentially, we're spending most on SMS in terms of our budget, and so there's several trends or changes that have occurred in these markets where we felt comfortable to be able to charge, to be able to ask for a payment, even if it's at a low discounted rate for this service, to be able, as one option to generate the revenue. For example, we do know that the mobile network operators are already charging right now, and other mobile companies locally are charging for different services, even accessing information about sports reports and things like that. So we felt that if this is appealing enough, if we had a strong value proposition for this, for this markets, they may be inclined to pay. So that's one thing. The other thing I'll tell you is that we actually were at an mHealth Summit meeting maybe 3 years ago, and we did a voting with your fee, and there are different kinds of stakeholders there. And there was a considerable number of people. We asked this question, should we be charging? And I know these are not our direct users, but there was a considerable number of people who were on the side of, yeah, let's start charging for this. Then lastly, we mentioned about willingness to pay, that we asked our users if they would be willing to pay for the service, and at least 48% said that they will be willing to pay something. So that's really why we decided to go with to consider user fees. One, again, as I said, it's because it's a considerable component of our cost structure, but also we felt that it could be a viable option. Now, as we shared with you earlier, we have user fees is definitely not one of the options that we are looking at. When we knew that this is not something that we can do by itself. So that's why, for example, things like, maybe partnerships with insurance companies, and they could pay for something. But we needed to have a business case of what is that something that we can sell to them, that they may find appealing. So things like marketing, we actually explored the push advertisements, and based on the consultations on the ground, at least in the consultations that we did in Tanzania, it didn't seem to be a very viable option from the outset, just because, we at that point we're thinking of tagline advertising, and people, because of the cost of the SMS now being low, companies are able to afford just paying for the full SMS versus just a tagline. So this was something that we didn't really continue to pursue. Actually, that's one, I should mention that this is another reason why we decided on user fees, especially because of SMS, because now also MNOs are offering bulk SMS. So people are buying these bundles, and sometimes they don't even finish their bundles. So, we felt that they could be willing to spend some of that SMS to cover for M4H, and you can add to that.
I would just say that I think while we tried very hard to be thoughtful in this approach and outline our different options and then develop decision trees and kind of move through them, the reality is always more complicated than that. So I guess that's to highlight a few points. One is that we always did envision that these would be interactive, and I think we're seeing that, as Christine mentioned. It wasn't that we necessarily thought we would only pursue user fees in Kenya ultimately, but it was compelling enough for the reasons that she stated. And frankly, this is me speaking, but within our kind of world, people were talking so much about user fees and that we should be doing it. There's a strong enough camp of people who think you should do it, and people were pushing you to do it, whether that's the donor or otherwise, that I would say that kind of tipped to the scale for us. It was like, we want to try this. We just want to know. We want to be able to answer the question. And in particular in Kenya, where we had felt like we had less traction on some of these other options, it seemed like a good choice. So while we were strategic and thoughtful and tried to apply those decision trees, there are lots of other things going on in the environment that ultimately lead you to make that decision. So we kind of went with user fee in Kenya for a variety of reasons that I think we just mentioned. And just to say that we are really, I guess, disappointed that we didn't get to complete it, and that's too bad. And so I'm still looking to other people for kind of similar experiences, or for us to have a conversation about whether that was the right decision.
And can you guys say a little bit more about that last option in terms of generating revenue, the offering anonymous user data to organizations? I think it's interesting. It sounds like what Google and Facebook and everyone else is doing with our data, but I'm not sure, what you guys have found, if it's possible or if it would require lots of legal.
Yeah.
We have, so first of all, we haven't explored it in practice. So we can't tell you how feasible is it as an option. But based on consultations that we've had, there is interest from several different parties, be it the private sector, be it the, like even the UN, to kind of understand better the user dynamics. And it's actually, this extends not only just to offer the data that we are compiling, but also being able to, if we have enough traffic, if we have enough of a user base, to be able for them to access our user base to do surveys. So for example, if UNICEF is interested in, understanding, knowledge of, women in breastfeeding or something, women who are not pregnant, for example, then if we have enough of a user profile, they may be willing to pay us to do that survey using our use case. And that would be a very fast kind of process and actually more efficient and perhaps actually less costly because they don't have to go out there and they can just, so these are the kind of the things that we're thinking about. But again, we have not done that in practice yet to be able to ascertain if it's a viable option.
And I think it was another one of these suggestions that a lot of people were making. And so when we would have our discussions with different groups and individuals, they often would say, hey, wow, it really sounds like you have a great database. Have you thought about utilizing that, sharing it with other organizations at an, kind of an aggregate level so that people, or just, in an anonymous form, so that they could use that for their purposes, and that may be an area of interest. But like Christine said, I think, again, being honest, I think some of these other options just seem to float more toward the top, and that one sort of hovered here, both in terms of, I guess, perceived barriers to the feasibility on our own side. We did not explore that as much, but it continues to come up, and I wouldn't say that it's off the table, in particular in Tanzania, with some of the potential partnerships that we're exploring there. It now may be one of those things that we explore further down the line, and how to kind of analyze it and break it up and then repackage it for different audiences and for different purposes, I think is probably still quite a possibility in Tanzania.
Hi, thanks, Christine and Trinity. I just had a really quick question or clarification. I think earlier on you mentioned that it was about 48%, like a greater proportion of people in Tanzania that were willing to pay than in Kenya, which was 67% who weren't willing to pay.
Right.
So I don't know, maybe I missed it, but why did you pursue that in Kenya as opposed to Tanzania when you had?
Yeah, so in Kenya, we actually didn't know. So we didn't do the willingness to pay data collection in Kenya until that round one, until we had already decided. Okay. So in some ways, it could be an important lesson learned about transferability of data from country to country. We had done it only in Tanzania, and we thought, oh, great, maybe it's the same in Kenya. And again, as I alluded to earlier, part of what drove our decision making in Kenya was perceived lack of feasibility of some of these other options. So that's why we didn't have willingness to pay data in Kenya. We decided to include it in that round one with the idea that if we gave options, the way the question was structured, they had options to say, I don't want to pay anything, I want to pay 5 Kenya shillings, 10, 15, 20, that we would be able to peg the price point in that round two. And, in round one, 67% said nothing. The remaining, there were certainly some percentages. The next highest, as you can imagine, was 5 shillings. So yeah, I mean, had we proceeded. Had we proceeded, we still probably would have had some internal debate about what that price point would be. But it is, I guess, what it is. Yeah. So anyway, it's a good point.
Yeah, and in Tanzania, why we haven't pursued it, actually, it's work in progress. As we mentioned, we're now exploring potential partners, and in all the 3 proposals, user fees is in there. So whoever we choose to go with is something that we're going to definitely explore.
Okay. And I also just had another question about when you said about the user fees in Kenya, you had kind of disaggregated based on like different socioeconomic quintiles. And if you were to kind of have some type of tiered pricing, like how easy would it be to get that level of data when you actually are running the service? Or would you just have to have a standardized rate?
Yeah. So I'm not sure, I'm going to answer it this way, and it may or may not be the answer to your question. But one thing that we actually thought quite a lot about was how we could get the socioeconomic status as part of our basic demographics, because we were very interested in seeing what the impact would be on our user base and if we would switch, kind of profiles going from free to paid. And so internally, we did a lot of kind of thinking and exploring and talking about how, in a very simple SMS-based, survey question, we could obtain information on socioeconomic or really economic level. And we ultimately arrived at the impracticality of that. I mean, I think a lot of people know those kinds of measures are often a composite of, upwards of 30 questions, but minimum we could get down to was like 7 questions, which was not feasible either. So in this instance, we decided that we would be somewhat satisfied on using education as a proxy, recognizing that that's not always the case. So that was our idea in this experiment, was we would at least look at education level to be able to make some kind of conjecture or guesses, around who those users were. And that was what we were going to do in terms of comparing across the two. We hadn't necessarily gone farther, I think, in our bigger thinking about how we could routinely collect that information and thereby peg people at a particular price point. I think, I understand that some folks like Mama have done that, and that it's been pretty complicated. So
yeah, and I think in general, like people would be, even with a higher wealth quintiles, will be willing to pay more if you have a different offering. So it wouldn't be the same basic offering just being offered at different price levels. We'll have to definitely develop a more sophisticated product for targeting that higher wealth quintile with a higher price.
Okay, thanks. Yeah, I think that kind of addressed my question. Thank you.
So I'll go back to the questions in case anybody needs to jog their memory.
So are you all also pursuing these different pathways? Maybe because we're also keen to learn from you all as well.
I think, yeah, so just kind of looking at the participant list, I know we may not have a sense of who everyone is, but there's Dimagi, there's Jody Ann from Village Reach, there's someone from IRH, Sesame Workshop, and I think these different projects have explored different ways of financially sustaining themselves, depending on however we decide to define that. So it would be great to hear from other experiences. I know IRH has done a lot of thinking into this as well.
Yeah. And I think it's probably easier if it's built in within the organization kind of framework as well, versus if it's just in just one particular project. I'm just thinking about Dimagi, for example, if somebody's there to share, because that kind of is built in within your company's strategy, organization strategy.
Hi, do you hear me? This is Marco from Dimagi.
We hear you.
Yeah, so it's really interesting to hear that you guys had a little ambiguity around impact and how people define the impact. Like you guys mentioned, it's impact in Dimagi is engraved in our model system, business model, sorry. So it's we deal with impact, social impact on a daily basis, and I can share how our partners define social impact, and we really try to define the workflow of our applications around that specific impact. So it really all depends on what type of indicators the projects are actually measuring that have a direct link to that beneficiary impact. And I guess from the point of view of pricing, it's interesting to find out how in these other countries. So I'm based in Mozambique, and my experience mainly is around projects here. I actually was involved a little bit on the MCENAS project. So it's, I think we also talked about at some point pricing the registration process for the MCENAS project. So it's interesting to find out that in other countries, 60% of the surveyors were were willing to actually pay for that service. So I think for Mozambique, it will be just maybe less because of the population financial situation is very different than Tanzania and Kenya. So I think it will be different. It's very contextual, I guess.
It's interesting because a couple of things come to mind. So in some ways, Demagi, in the way that I think about how you operate, is really kind of like the business to business solutions. And so what are sort of different dynamics between kind of a business to business solution versus kind of a business, business to client facing solution. And the other thing is that we thought actually internally in our original proposal, the third option where we talked about tiered pricing, we were also thinking about kind of a Demagi-like or a ComCare-like model where you have packages of services. And we did spend some time thinking about whether we could, with M4RH, think about offering kind of a business-to-business solution, in this case, of a basic package of M4RH, and then kind of increasing the levels of technological functionality and kind of the content design, implementation, technical assistance type work that we could provide. But again, interestingly, in some ways it comes back to the organization and who the organization is and what that would mean in terms of FHI kind of pivoting to be able to offer that type of a service seems sort of beyond the realm of the control or maybe the timeline of this particular grant. And so ultimately we did not pursue that, given that the folks working on this team have been largely around kind of content development, implementation, technical assistance, and not the technology side. We had this other technology partner. But yeah, I think, as you said, we certainly have ideas of what we would measure for social impact. I think the question becomes more, what are acceptable thresholds? And like Christine mentioned early on, we understood that we would want to maintain some demographic profile. We want, but the question really is, where the rubber hits the road, what is that? Below what level of overall traffic and below what kind of, level of economic status or education status or age are you comfortable and still feeling like you're reaching your social impact goals? So I think that's a big challenge in and of itself.
Yeah, I think.
Oh, go ahead.
Sorry, just to add to that, there's for Demagi, there's a fine line between beneficiary impact and organization impact, meaning programmatic impact or more social impact. And we try to push forward more towards the social impact instead of the programmatic impact. For example, a numerator project might be a lot more of a programmatic impact, where you're trying to just track something and get your numbers, versus benefiting, making a beneficiary, helping a beneficiary, I guess is the correct word.
Yeah. I'm curious, I don't know if IRH, if Nikki is on and would maybe have something to add to that discussion about kind of balancing the reach and the social impact. I think y'all are working on that, and also the user fee, how that comes into it.
So I work, I'm sorry, do you want to go ahead?
I was also going to say, I think we also have Jasmine from Philippines that also wants to add something. But please go ahead first. Okay, so I work in one of the IRH projects called Cycle Gel in India, and it's one of the questions that we've been discussing recently, because we have a mHealth service, and one of the ideas was on how we can make it financially sustainable. And it's definitely, we've not really started
on the research aspect of the project, but definitely one of the concerns has been, just looking at the preliminary results from a telephone-based survey, a lot of people have shared concerns about they're just not signed up for the service because of the whole fear of having to pay for it. So we're now having to go back to the drawing board again and look at what are the other alternatives to user fee for now to at least get the users on board. And in that context, one of the things I wanted to find out is really, you had mentioned that you were working with different kinds of partners in Tanzania. So what kind of partners did you see really showing interest in the service, whether it was from the private sector or the government, and if it was the private sector, what kind of organizations really?
So that's a great question. So what kinds of partners in Tanzania and showing interest, and maybe why?
You mean interested in partnering with us to create the kind of a social business model?
Yeah.
Okay, so we had, like Trinity mentioned, we had 3 different potential partners that applied, and they were very different. So the one was like, I wouldn't call, I guess it's a startup. Yeah, I can't mention the names. So, but it's, I would call it a startup, but it's a more kind of advanced startup, I would say. So not completely starting from scratch.
And a technology.
And then it's it's a technology startup, but also has worked in health. Then the second one, and that technology startup offered great innovative ideas, and we've been very impressed actually by approaches where we can reduce the costs, go around things like SMS, the traditional SMS and things like that, exploring other channels like WhatsApp, like mobile sites, like all these other things that we can target different kind of user segments who are using different kinds of channels. So that could, with the eventual goal of reducing costs. So that's one. Then the other one is a nonprofit. Well, sorry, it's a private sector actually now, no longer a nonprofit. It's a private. They were just bought. So it's a private sector, but very much operating like a nonprofit in the project before. But they have been very successful in negotiating with MNOs locally to get 0 rating on the SMS, and also be able to leverage different partnerships to cover the different costs. So for example, once you have the content, you also have to distribute, you have to promote the service so it can be used. So, and that is a huge cost as well. And so being able to leverage those partnerships. So their model really is dependent on the MNO, 0 rating, and partnerships. Then the third party is a nonprofit actually, and they have also been successful in negotiating with the MNOs, not completely 0 rating, but significantly 0 rating the service, but also it's kind of attached to a business case for the MNOs. So the MNOs are getting something in terms of driving traffic to their service, loyalty, but also at a certain point, so for example, once you've made 10 calls or something, because they're going to be offering it on IVR, then you will be charged. So there is some profit that they are projecting, but it's based on them being able to fulfill those agreements with the MNOs to be able to continue that service. So it's like 3 different kind of partners who have very different models there's some pros and cons in each of them that we need to consider.
And I would just say that across all 3 of those, so there are different interests, and in particular, that kind of technological startup, you might think, or I think we could suppose, and I suppose they also told us that the interest is really in just kind of branching out, doing different types of work, getting their name out there. So, they may have one interest fairly different from the other 2. But in all 3 scenarios, as we mentioned among the lessons learned, there is some element of donor funding. So different pieces of the kind of cost pie can be managed, but there's still a sliver that seems to require, at least in the short term, donor funds. So that's also, I think, interesting and really important, and perhaps, you know, unique in some ways to the health sphere, you know, or this kind of area that we're all working in, coming out of it largely as nonprofits, but still, I think was important for us to see.
And also, I should say that there are some that are progressively kind of showing that they will eventually phase out of donor funding. That's another one, but it's at this point all just projections. Yeah, go ahead.
Great. Thanks, Christine and Trinity. I think that's really great. Just looking at the time, I think a lot of people are having to drop off, and people have said thanks a lot and they'd like to see the deck. So if you're able to send that to me, I'll send it around to the group later today with the recording. I can also include these discussion questions in the Knowledge Gateway post, so that hopefully we can continue the discussion on that platform. But just wanted to say thanks again for a great presentation, and looking forward to having more sessions like this led by grantees in the future.
Great, thank you.
Thanks.
Christine and Trini, can I just add one thing? I know that this is going to be part of a peer-reviewed publication eventually. Is there anything that you want to mention about that, about where people can get more information, or where we can expect, when we can expect that, or is that?
So the thing that will be coming the soonest is actually on kind of the cost, so operational costs, and then doing some of the analyses around that. Probably, I think it's going to be submitted this week, actually. So that should be forthcoming. The rest, we don't have as much of a timeline. We're going to do some, not just documentation, non-peer reviewed between now and the end of the grant. But we'll still, I think, be looking for other peer review opportunities. Like, I don't know exactly when.
Great, yeah, it doesn't have to be peer reviewed. Thank you.
Thanks, everyone. Have a good day.
Thank you.